welcome. We are so grateful to see you, albeit virtually. Thank you for managing with us through some twists and turns over the last couple of days. Nobody can say we don't take health seriously here at the Tribal Climate Health Project. So we are very happy to welcome you to day one of the Tribal Climate Health Adaptation Summit. And we've got a full couple of days for you. We're sticking with the schedule that we had. We wish we were there with you in person. Some folks are actually at Paula, and we are going to live vicariously through their experience. Maybe they can share a screenshot of the pool from where they're at. So let's go ahead and dive in. I want to tell you folks a little bit about just the logistics around Zoom. I'm not assuming that everybody's probably familiar with Zoom, but let's go ahead and go to the next slide. So we would love it if we could try to make this as interactive as possible. We have so many moments scattered throughout these next 2 days that are really interactive. You're going to have a lot of chances to talk to each other and speak with in larger groups. So, but you don't have to have your camera on the whole time, especially if you're having bandwidth issues. But to the extent you can and feel comfortable, we'd love if you'd have your camera on so we feel like we're talking to each other. You can always use your, you can raise your hand or use the chat. There's lots of ways to interact. Chat's probably the easiest way if you need somebody's attention. So you can chat with me. I'm Angie Hacker. You can chat with Serena Soar or Serena Vega directly if you need some technical help. And then, you know, you can always use emoji reactions. You can mute yourself. We would recommend muting yourself unless you're ready to speak, unless you want us to hear what's going on at your house or office. So that's a little bit of housekeeping. Next slide, please. The other thing to mention here is we're recording this because that's one of the benefits, I guess, of going virtual is we can actually record and potentially share portions of this eventually, but we won't be able to record things like breakout sessions, and we're going to be mindful of what we're able to share. So just want to let you know we are recording, and we'll kind of manage later how we edit and share any pieces of this. With that, I want to say a big welcome and hand this off to my co-host, Dr. Shasta Gaughan. She's the Environmental Director of the Paula Band and Mission Indians. Most of you know her, and you know that she is sick, but the biggest trooper we know, and she is the Director and Administrator of the Tribal Climate Health Project. Okay, Shasta, take it away.
Thanks, Angie. I also I want to note, as George did in the chat, that I haven't looked like that picture in a while. So if now I'm on camera with my shaved head, but I also want to note that I don't know whose phone number that is. I think it might be Angie's husband's phone number. My phone number is, I'll put it in the chat if you want to call me. But yeah, I'm Shasta Gaughan, and I'm gonna be here as I can. You know, as you can tell from my voice, I am sick with COVID. This is like day 6, I think, and feeling okay, but not great. So I'm gonna participate as I can. But before we jump into our content, I want to turn the camera and the microphone over to our chairman, Robert Smith, to welcome everybody to virtual Paula. Chairman Smith.
All right, good morning. Good morning, everybody. I'd like to welcome you on behalf of the Paula Band of Mission Indians. I wish you all well in our discussion here, and have a good discussion, have a good day, and continue to plug on. Sorry we have to do it virtual, but that's the way it works. But again, thank you and have a good session.
Thank you, Chairman. Really appreciate you taking some time with us today. And then, as always, we want to start things off in the right way and in a good way, especially when we have all of us tribal folks and folks who work for tribes who are doing this hard work. We can't do this without going into it with the right opening, and that means a blessing. And so I want to invite one of our seniors, Paula seniors, Mr. Eric Ortega, to open us in that good way. Eric.
Thank you, Pavishka Chai. I'd like to open up with a prayer. Good morning, everybody. Let's see. Chumna, Tukachio Kiki Hilka, a Toa Chumyuk Nanganika, Aniquepa Chumbao Chachain, Aniquesh Ichish maybe Awayana to Ma'alma Tukachia, Chuma'a Shavi Tumitri, Kayap Pachanga Wanash, Elalichis maybe Chimichaiwana, Machbakai Chaiwanash, Chumkaitim Pamyuk, Kaichum Chum Petrulpi, Elalichim, Pemayawish, Chamami Pemakichi, Penam, Icham. That's a prayer that was taught to us when we were really young. It's a translation of the Our Father in the Campanian language, as taught when we were from Rosetta Lasquez and Tommy Pertillo. And thank you all. And it's a pleasure being able to greet you all and welcome you to this Zoom meeting. Hope everything goes really well. Thank you.
Thank you, Eric Icham. And now I think that we're going to dive into our content. Excuse me, hopefully my voice will last. So I want to give you a brief overview of what we've been doing with the Tribal Climate Health Project over the last 6 years. So again, this is based in the Paula Band of Mission Indians Environmental Department, and I direct the Paula Environmental Department, and we are in northern San Diego County, California, but this is Payomkuicham territory, Kupangawicham, and that's Luiseño and Cupeño. Right now, I am coming to you from my home in Escondido, California. It's about 25 miles south of Paula. And this is border. It's Kupangawicham and Payomkuicham and also Kumeyaay border territory here in Escondido. And for the Tribal Climate Health Project, we started in 2015 with money from the EPA to develop this training program. Excuse me. Thank you for not having me on camera while I cough up my lungs. Yeah, I see Eric is still spotlighted, so poor Eric is like, I can't leave. But we got money from EPA to start this project, and then with the change in the administration in 2016, the money unfortunately was no longer allocated, but we were able to get funding from the BIA, from the National Indian Health Board, and from some other sources to be able to continue doing this work on bringing people together to learn about the health effects of climate change on tribal communities, and working with Prosper Sustainably, and that's Angie and Josh Simmons, her partner and husband's company. We've put together advisory groups, trainings, materials, workshops, workbooks, website, all sorts of tools for folks who are doing this hard work on developing vulnerability assessments and adaptation plans for tribal communities, and making sure that we are including the health aspects of climate change. And by health, meaning not just health like, you know, whether or not you have a cold or the flu or, you know, malaria from a mosquito or something, but also things like our cultural health and our mental health and overall community health and well-being. And that's what we've been working on. And this is a part of our latest round of funding from the BIA. And again, as you all know, it was supposed to be in person, but we're doing what we can here by transitioning to virtual. And again, as Angie said, really appreciate your flexibility and willingness to roll with us as we make this as safe and healthy as we can for everybody. Angie.
All right, so I get to give you all an event overview. And first, I'm just going to start with a little introduction of myself. Go to the next slide. So I'm Angie Hacker, and I'm Shasta's co-conspirator with the Tribal Climate Health Project. Like she said, I'm with Prosper Sustainably. We are a small firm serving communities across the country, tribal and other communities in the areas of climate change, energy, and sustainability. I've been doing this work for over 20 years. One of my favorite things I've ever done is work with Shasta on this program, the Tribal Climate Health Project. So I also get to work individually with tribes on doing adaptation work, and also work on a state contract, California Tribal Gap Analysis, where we're trying to actually ask tribes in California about their experiences with climate change adaptation. So I just care deeply about this work, and I'm so fortunate and grateful to be here with all of you. We are really fortunate to have operated the Tribal Climate Health Project for 6 years with the funding that we've been given, and we've served over 1,300 or 1,400 tribal serving professionals that we know of, aside from those that we probably don't know we've reached. So we're just happy to add you to our growing community of practice. So here we are. I want to tell you a little bit about kind of the thought behind our theme, which is getting to the heart of vulnerability. We're here in 2022. We're floating around on the only life-sustaining planet we know of. A miracle made possible by a lot of things, including a thin layer of atmosphere around our Earth, the concentration of which we have changed past a critical tipping point. So here you are, having come here. You were willing to travel all across the country, all the way to Paula, to make this investment and learn how you, and if you're like many tribes around the country, maybe only you, can stand between the effects of climate change and the people in your community, the community that you're serving. You stand between worsening heat, drought, storms, flood, wildfire, melting ice and sea level rise, and its effect on your community. It's elders, it's children, it's cultures and traditions, it's water, it's food, it's other sacred resources. All of the things that form the foundation of a stable community and health and well-being. So someone in that community has to know, embrace for what is coming, and that someone might be you. That can be a heavy place to be. And so we thank you for your work and for being here. And we're grateful to support you in this critical work. That's our passion at the Tribal Climate Health Project, to arm you with information and whatever we can from the outside to make this pretty big lift a little bit easier. And here at this conference, giving you a little chance to reflect, take some moments to fortify yourself a little as you do this difficult work. Next slide, please. Let's get a few terms. Let's go on the same page with a few terms and just the objectives of this conference. So what is vulnerability? One definition of vulnerability is the degree to which natural built and human systems are susceptible to or unable to cope with the adverse effects of climate change. So we're talking about vulnerability specifically in a climate change context. And a lot of what we're going to talk about over the next couple of days is how do we understand our vulnerability? How do we understand it well enough so that we can do something about it, right? So we can be this person standing between the impacts of climate change and our community's health, trying to divert adverse effects where we can. Well, we're going to talk about a vulnerability assessment. Now, that sounds like a very pragmatic process to go through, and it is. But the idea is to identify any blind spots we might have about some of the impacts that are coming our way. So one definition of a vulnerability assessment is to use available information to identify and prioritize anticipated climate impacts on a community, given its location, its sensitivities, and its existing capacity to adapt. So we're going to talk about vulnerability in general. We're going to talk about our personal vulnerability, and we're going to talk about how to actually walk through the steps of assessing our community's vulnerability with a lot of information so that we can be prepared to make the best decisions about how to prepare and adapt as we possibly can, and how to use our limited resources as best as we can to protect our community and potentially save lives. So the summit objectives over the next couple of days, we want to learn the steps of conducting vulnerability assessments, and not just in general, but ones that really focus and center on health and well-being. We're going to build knowledge of best practices, options, and examples related to gathering and weaving together data, traditional knowledge, and community perspectives, managing interdepartmental coordination and reporting findings. These are all part of doing these assessments. Deepening our understanding of the linkages between health and climate change, including, we have a lot of good speakers. So we have some researchers that are going to talk about their emerging research topics, participate in peer learning or peer discussions and exchange knowledge and experiences. So you're not just going to hear me speak or even our experts that we've brought in to be speakers, but we're going to hear a lot from each other, and we're going to learn a lot from each other and your experiences. So I know it's harder to engage online, but we really do hope that you can stay present with us. And we're also going to engage in guided sessions that promote personal connection and reflection. So let's talk about that. Next slide, we're going to talk about our schedule. We're holding our schedule pretty much like we would have otherwise. We want to acknowledge that that's difficult for some of you on the East Coast, especially later in the day. But once we're done with this, after this, we're going to have a really interesting introduction activity where we're going to get to know each other better. We have a few breaks strewn throughout. Our big chunks of content today are really the tribal climate and health overview. And then we're going to spend some time after lunch in roundtables where we're going to talk to each other about our experiences in exposures with climate exposures and specific kinds of impacts. After another break, we'll do another sort of content-based lecture, but also an activity around vulnerability assessments, just walking through an overview of the steps. I'm going to take a look at examples of vulnerability assessments. It's an exercise and talk about it. And then we're just really lucky. Both days are going to end with these reflection sessions that we're calling taking care of self and others. And we're so fortunate we have two really good facilitators with us from the Trauma Resource Institute that are going to help guide us through some of these personal reflection elements that are going to be woven through this conference. We'll talk about day 2 tomorrow, but that's our day 1 agenda. You can also find your agenda in the workbook, and we're going to talk about the workbook in just a moment. Next slide, please. So I am really, frankly, I have to say grateful that I get to introduce Serena Soor, who she's a subcontractor with Prosper Sustainably. She's a project management consultant. She is brilliant. She is the one who really pulled off actually this whole conference. She's our key organizer, and she helped us feel like we could do it when we had to transition to online. And she's really been main part of that whole conversion process. So thank you, Serena, for everything you've been doing over the last, 8 months we've been at this. And she's going to tell you a little bit more about the workbook. Thanks, Serena.
Thank you, Angie, and welcome everyone. I'm so glad that we could still join and be with each other despite the circumstances. Like Angie said, my name is Serena Soor, she, her pronouns. I am calling in from Tongva Lands in LA County. And yes, I've been working on this project, the Tribal Climate Health Project, for about a year, and I've been working in the nonprofit climate change space for about 4. So I'm going to be supporting y'all with Zoom today. If you have tech questions, you can chat me or the other Serena on the line, Serena Vega. We're happy to help, along with Tina Fernandez as well over at Paula. So I am going to tell you more about the workbook now on the next slide. Here's a quick link you can type in. It is case sensitive, or you can just click the long link that was sent in the chat. And I'm just going to show you what our workbook looks like, what you can find in there, and how you should access it. So y'all can see this PDF, correct? Perfect. Okay, so here's our workbook, and this is on the web. So I'm going to suggest you click this download button. If you have visited this page before this morning, you might need to refresh it because we did make a slight edit. So just make sure you get the latest version. And our workbook is just all the information you're going to need. So we have some information in here about us, the organizers, about those objectives Angie spoke about. We did get the updated virtual agenda in here. Like Angie said, it's really similar. We just folded in some quick short breaks because I know it's really tiring to look at the screen for too long. You can also find all of our speaker bios information in here if you want to learn more about our experts that are going to be joining us. And then each, or not each session, but many sessions have some guided prompts and activities. This is a fillable PDF, which is why I'm suggesting you download it to your desktop or a file on your computer so that you can continually save your process, and just make sure you access this in your PDF viewer like Adobe or Preview or whatever your computer uses, so that you can save your progress and you don't lose it. So there are some embedded links in here that you'll want to access when the time comes, and we will make sure that we guide you through and let you know what pages you need to access when the time comes. So again, please just take a moment now to download this if you haven't. I know Shasta also emailed it out before we met, so you can access it that way as well. And yeah, if you have questions about the workbook, just let us know. Thanks.
All right. Thank you, Serena. Are there any questions at this point about any of the logistics or the workbook? Just go ahead and raise your hand if you have them, or throw something in the chat. All right. Don't see anybody with questions yet. Okay, so next slide, please. So this is my chance to say a big thank you to all the folks that have made this conference possible. And we do want to say our thanks to the BIA. The Tribal Climate Resilience Program is the funder of this particular event, and quite a bit of what the Tribal Climate Health Project is grateful to be able to do. Big thanks. Thank you. I don't know if Eric or Chairman Smith, if you're still here, and all the folks at Paula, thank you so much for continuing to provide such national leadership with the Tribal Climate Health Project, and for being willing to host our event today. I personally really appreciate the leaderships. Thank you to the team. So obviously Shasta and Tina Fernandez is here too. She's been part of our organizing team with Paula. She's on the Paula Environmental Department team. And then of course, big thanks again to Serena Soor. Our speakers, we have a long list of speakers. I'm only sharing this list not to say it out loud, but to show off because we have such a great group of partners around the country. And this is a small segment of some of our favorites that you'll get to hear from over the next couple of days. And we just really appreciate their flexibility and cooperation over the last 8 months or so as well. All right, so that's the overview. And we're going to actually now get into participant introductions.